So thank you very much. I hope that you have some appetite left for the last session. I'll try to be brief. I don't do this for a living usually, so bear with me. My name is Pepe. Calamar is just a nickname from the university that I don't even understand. And I am an emergency coordinator. Usually when I start a conversation like this, my interlocutor raises the eyebrows, looks at me right in the eye and wonders, what the hell is this guy talking about? What does he do for a living? Yeah. I'm going to try to explain that and how somebody like me, who is friend of Luis, ended up doing this job and being actually probably the most intelligent decision that I ever made. So, first of all, MSF, in order to avoid confusions, Médecins Sans Frontières, or Doctors Without Borders, it's for those of you who maybe don't know it, it's an international independent medical humanitarian organization. And we specialize in providing assistance to people affected by humanitarian crises. Humanitarian crises such as conflicts, obviously, Gaza now, obviously, Sudan, Lebanon, you name it, we are probably there. Epidemic outbreaks, cholera, measles, meningitis, viral hemorrhagic fevers like Ebola or Marburg in Rwanda now, natural catastrophes, of course, massive displacements of population, refugees, and exclusion of healthcare for important amounts of populations anywhere in the world. Our actions are guided by medical ethics, so we are doctors, nurses, logisticians, etc., and by the three humanitarian principles, which are independence, impartiality, and neutrality. Neutrality means that humanitarian aid must not favor any side of the conflict. So we don't take sides anywhere. Impartiality means that humanitarian aid must be provided only on the basis of needs, necessities, nothing else. So we don't discriminate. We don't discriminate anybody. We treat everybody who gets to our hospitals or whom we find in the communities. And finally, independence means that humanitarian aid must be completely autonomous from any political, military, or economic objective. That's why, for Doctors Without Borders, the money that we receive comes from people like you, people like me. We don't usually take money from public institutions, governments, etc., because there is usually a risk inherent to that. In any conflict, if you get some money from any actor that could be remotely connected to that conflict, you could be in danger. And this happens almost all the time. That's why we get the money from people in the streets, from people whom we try to explain our job to. We have been doing this since 1971. It was first originally founded by a bunch of doctors and journalists. So one of our core commitments is not only medical action, but also bearing witness and provide testimony, of what we see, what the realities we see on the ground. We are obviously a non-profit organization, and usually now we are around, I think it's somewhere there, almost 70,000 people working in the movement as of today. Many times in the humanitarian world, along the years, it's said that MSF is where nobody else can or nobody else wants to be. Me, I've been doing this job for the last 15 years. My first mission was in Ethiopia, back at the end of 2009, and since then, I've been serving in many countries directly on the ground, countries such as Yemen several times, Central African Republic several times, Congo several times, Syria, Mali, Niger, Madagascar, Mexico, recently South Sudan, and Afghanistan before, during, and after the takeover. And also, I've been working from headquarters, still coordinating our operations on the ground in countries such as Burkina Faso, Mozambique, Ukraine, and lately, obviously, the occupied Palestinian territories, Sudan, and Chad. Now, what does an emergency coordinator do in my day-to-day? Because I am not a medical staff, I'm not a health professional. I don't save lives directly. What I do is a little bit more simple, although at times it gets complicated. What I try to do is basically, for every crisis, get the right people in to the right place inside the country with the right equipment, supplies, materials, medicines, and in the right time to do the right thing to the right people. In other words, what we try to do is reach out to those most affected communities, populations, by any crisis in the world, with enough human resources, enough people, enough colleagues, enough supplies, enough equipments, so that we can try to treat their life-threatening conditions. What we do is we try to reach out to those most affected communities by any crisis. And this means that their life is usually at risk of life or death. At risk of death. This is what we do. And we try to do it every day. We may need to save the same life today, tomorrow, the day after tomorrow. This is what we do. Right here, right now. We don't do anything else. We don't change people's lives. We don't enhance people's lives. I mean, this can only be done by development, economy, employment. What we do is what I explained. And if we have to do that tomorrow to the same person again, we will do it. There is nothing else and nothing less. Yeah? In order to do so, the most important thing is to do it as quickly as possible. You have to be there, if possible, better in less than 24 hours, if not in 48 hours, if not in 72 hours, and so on and so forth. Those first, the most acute phase of any emergency, the first 3 to 5 days, is where you can save more lives, where your impact is much more accentuated. So to do so, in this line of work, you need to know a little bit of public health policies, a little bit of medical strategies, geopolitical analysis, security management, a little bit as well, certain different styles of leadership and team management, obviously. And yes, you need to be able to talk, to negotiate with God and the devil, as we say, with anybody, even governments that you would despise, even armed groups that are labeled as terrorists by many governments. You gotta put your prejudices, your biases aside and do the job, because people depend on that. At the same time, as you can understand, we are confronted with impossible choices many times. As I was saying, bearing witness and giving testimony is one of our most important actions. But this can very easily lead you to being kicked out of any country by any government or by any armed militia who controls actually the territory. They don't want to hear about what they are doing to those populations. But at times, if you do that, you will not be able to treat them anymore. So how do you make that decision? It is very difficult. And as you can see, because you are living it yourselves and probably your families as well, the world is getting darker and darker. It's not becoming a better place to be. There is an increasing disregard for human life. The loss of human life of civilians, apparently, it doesn't matter anymore, anywhere. We were seeing that in some specific contexts. Now it's everywhere, it's in the media. So let's say that the world is not anymore black or white. There is not black or white decisions, no black or white situations. There are different kinds of gray dilemmas. But still, you gotta operate in the abstract, in the gray. You need to position yourself and make decisions so that you can try to help somebody else. This is what we need to do. And I'm sure that you also do that in your normal, current daily lives. Because, as you can understand, one of the most difficult parts of this job is probably to calibrate a series of security risks. The likelihood and impact of a series of security risks. And risk zero does not exist. It doesn't exist for you when you cross the streets, etc., or you take a plane. It doesn't exist either, risk zero, in our profession. Bombings, landmines, shelling, shooting, crossfire, abduction, kidnappings, physical violence, rapes, you name it. But still, you need to figure out how to mitigate as much as possible those risks so that they can become so that the residual risk becomes acceptable for your organization, before you make the decision of sending your teams in. And then before sending them in, you got to think, does the benefit and the impact that the medical, logistic, etc., teams are going to bring to that affected population, does it justify, does it compensate the risks that I'm going to put them at? Well, this is it. This is what we do, and make no mistake, we are not martyrs. We are not monks driven by religious beliefs or by altruistic purposes. Anybody working for MSF has their different drive, has their different motivation, but we are professionals. We get paid for it. Not much. We are not the United Nations. That's true. However, if you manage to exert that leadership and you negotiate your access with governments and groups and the community accepts what you're going to do for them, and you get the right people in, the right supplies, etc., then you might find out that you are the last line of defense. You are the last resort for tens or even hundreds of thousands of people with no access whatsoever to any kind of healthcare, because there are no hospitals around, no health centers, no nothing. In conflicts or even in different humanitarian situations beyond conflicts. You could see yourself like what we are doing today in Sudan. Sudan, where there has been a war for more than 500 days already. It broke out in April last year. The disruptions that the conflict has created, has caused on the health system, which was already quite precarious, now makes that vast areas of the country are completely forgotten. Now, what we are trying to do is to reignite some of these parts of the health system by setting up hospitals where we treat emergency cases, the most critical cases, pediatrics, maternity, surgery. At times, we will also reinvigorate the network of health centers to provide access to health for many, as we were saying, hundreds of thousands of people. Or, as it's happening now in Lebanon, we may need to jump in a car, in a Land Cruiser, and go to do what we call mobile clinics, which is providing simple healthcare anywhere that we can reach, including mental health. And those cases that we cannot treat, we will refer them to the closest hospital. This is what is happening, this is what we do. Or, at the same time, in Gaza, obviously, we are not only involved in providing surgical treatment for those wounded by the bombs or by the buildings crumbling down, etc., etc. In conflicts, the usual medical conditions that affect children, women, etc., they don't cease. There is still deliveries. There are still deliveries, usually outside any hospital, outside any health center. People can die of a myriad different causes when they are living in crowded camps, buildings where there is no sanitation facilities, there is no hygiene, there is the possibility of suffering many transmissible diseases. Diseases, like today, for example, in Congo, we are vaccinating tens of thousands of people for the Mpox, but every year we have to vaccinate tens of thousands, hundreds of thousands of children against measles or malaria. Malaria is the top one killer. Still, you wouldn't say so, but yes, it is. And that's what we try to do as well. And we are privileged for that. As we are privileged when we jump on a boat, in this case, in the Mediterranean, and try to provide a sort of exit to a nightmare in the sea to all those many migrants that are fleeing from violence, from lack of financial means, etc., etc., or in the Darien Gap. We are privileged to do that. And if you ask any of my colleagues, they will tell you the same. We are honored to be in those places. That is the drive that allows us to power through all those obscurities, anxieties, threats. Risk zero does not exist, and people have to make their decision before going to Gaza, for example, these days, or Lebanon. But with the right motivation, this is what we have seen in the field, with the right motivation, people are capable of anything. And knowing that you can make a difference for somebody, that you can give that somebody another opportunity to live another day, that is already something that makes or has a kind of creates a little change in you. Obviously, one of the best examples that I can ever think of that is our national colleagues, our co-workers that we recruit locally in all of these countries, and that before coming to your hospital, to your health center, or to your, when you drill boreholes to provide safe water, or you distribute non-food items, before they do that, they have to put their families at safety. I can think of many places where this is not an easy task to do, and they have to do it every day. And still they come and they outperform all of us. We are not in this business for the money, as I said. That's obvious, yeah. And motivations differ. In my case, as I was saying, nothing in my background or my upbringing would have insinuated that I would fall in love with this professional career path. Nothing. I had never made any volunteering when I was young. I studied law and business administration, and obviously had to live under the familiar threat of either you do something to earn a living or you will die under a bridge, etc., etc. And I worked in Rome, New York, London, and I was bumping from promising jobs to promising jobs, but I was never satisfied somehow. I was restless, no? That's in the character as well. But somehow it happened. I fell in love with this job when they posted me for the first time in the border of Ethiopia with Somalia. Completely in love. And I had no goddamn clue of what was going on in that place at the first time. Maybe, as people say, they may argue, well, you are still, you do that still 15 years after because you are still chasing that first rush of adrenaline. And at times, adrenaline keeps you high for a while. The truth is that maybe, as I said, I'm no saint, and I don't do this for altruistic purposes. Me, when I was young, I didn't want to dedicate my life to make somebody richer. It was not enough. I wanted to live. I wanted adventure. I wanted to travel the world. I wanted to make important things that mattered. Probably just gave a sense to my life. Or, as a movie director, Peckinpah, put it, said, I just wanted to enter home justified every single day. And well, voila. After 15 years, all in all, what I have seen in the ground is that with the right motivation, people are capable of making that difference. Anyone. Now the thing is, maybe big, maybe small, in your daily life, or something more activist, if you want. The difficult thing is to understand where to make that change, no? Where you can have your most added value, your biggest added value. But if somebody like me, who's, for example, my personal life is a mess, I have been able to do so, anybody can. And we see that on the ground every day. I am usually very cynical with respect to the humankind, and more these days. But still, reality contradicts me. Voila. Thanks for your attention. I think I've consumed much of your patience, and it's the end of the day, but I'll be happy to respond, if I am able, any of your questions.
Thanks a lot.